Hello again. I am Aditi Dubey. Today, we explore a chapter in the cancer story that often begins when the hospital visits slow down, when the last chemo drip is done, when the scans come back clear. It's called supervisorship. But supervisorship isn't an ending, it's a beginning. Complex, uncertain, and deeply personal. In Germany, there are now over 4.6 million cancer survivors, people who have lived past their diagnosis and are adjusting to a new normal. For some, supervisorship is a triumph. For others, it brings a cascade of invisible challenges: physical, psychological, economic. So, how does Germany care for this growing population? The answer lies in policy, insurance, and a surprisingly holistic idea of what care means. Let's start with the healthcare system itself. Germany's statutory health insurance, which covers the vast majority of population, doesn't just pay for acute treatment, it also supports long-term follow-up, including medical monitoring, mental health services, physiotherapy, and most importantly, rehabilitation, or as it's called here, Reha. Cancer rehabilitation in Germany is a structured, science-based process. It's not an afterthought, it's a right. After treatment, many patients are referred to rehab clinics, specialized centers where they stay for several weeks, receiving coordinated care, physical therapy, psychological counseling, nutritional advice, and social reintegration support. Survivors are taught how to manage fatigue, rebuild muscle strength, cope with emotional distress, and return to work if and when they are ready. And here is something remarkable: the employer and the health system often coordinate this. In some cases, there is even a gradual return to work program where survivors ease back into their professional lives at a pace that respects their health. It's not perfect, but it's thoughtful. Germany also offers cancer follow up plans, structured schedules for checkups, imaging, and lab tests, depending on the type of cancer. The idea is to catch any reoccurrence early and also monitor long term effects. Because the truth is, cancer survivors often live with complications: lymphedema, chronic pain, heart issues, fertility challenges. Then there is the psychological side. Surviving cancer doesn't erase the trauma. In fact, many survivors speak of a shadow phase, a quiet period of fear, loneliness, or identity loss. This is why psycho-oncological care continues post treatment. Support groups, therapy, and counselings are available and encouraged. But let's be honest, there are still cracks in the system. For survivors of rare cancers, follow up care is often less coordinated. Rural areas still face shortages in specialized rehab services, and immigrants, especially older ones, may struggle to navigate the bureaucracy or find culturally competent care. Economic challenges also persist. Even with robust insurance, out of pocket cost, job insecurity, and long term disability can create financial stress. That's where non-profits and survivor led organizations step in. Germany has a vibrant civil society around cancer supervisorship. People who advocate, educate, and build community. People who have turned their pain into platforms. In recent years, we have also seen legislative reforms aimed at strengthening long term support, including better digital documentation, more flexible sick leave policies, and patient navigation services. And perhaps, most importantly, Germany, like much of Europe, is beginning to ask, what does it mean to thrive after cancer? Supervisorship isn't just about not dying, it's about living well, with dignity, autonomy, purpose, and care that walks beside you long after the fourth drip is gone. Whether you are 25 or 75, whether you have had breast cancer or testicular cancer, whether your scars are visible or hidden, Supervisorship is a deeply human journey, and Germany, with its blend of policy, empathy, and structure, offers us a model worth studying and evolving. This was episode 15. I'm Aditi Dubey. Thank you for listening.